Hey everyone, my name is Carl, and along with my wonderful team, we worked on predicting social service outcomes with a nonprofit called HealthLeads. So HealthLeads is a nonprofit organization that's nationwide, based in Boston, that was started based on the insight that, hey, you know what? A lot of people go to hospitals who have health concerns that are really caused by things that are not health related. So for example, if you have asthma, oftentimes that might actually just be because of environmental factors, such as you might live in a very moldy home. And although medicine can get you somewhat healthy, it isn't going to get you a better house. So HealthLeads came into existence to kind of bridge this gap between social services and health. And what they do is they train college students to work with patients who get referred by doctors, who these doctors think can benefit from having a social service worker working with them to get them the resources that they need, which is a really great idea, and they've had a lot of wonderful work in the past 20 years. But unfortunately, they also face a really big challenge. About 40% of all patients who come to work with HealthLeads just disconnect from the program. What that means is they say, yes, I want to be part of the program, please sign me up, but then HealthLeads later on gives them a phone call and they don't pick up. They don't reply to emails, they don't reply to texts, they don't reply to letters, they don't reply to voicemails. And long story short, HealthLeads just has absolutely no idea why these people left their program, even though they originally said they wanted to be part of it. So that's why they came to us in DSSG. They had hoped that we could look into their data and find some of the factors that contribute to somebody disconnecting from HealthLeads. So this summer, my team and I worked on building a model that can predict the likelihood that somebody is going to sign up, but then later on disconnect from the program. And although we looked at a lot of different variables, today I'm only going to talk about the two most significant ones, one of which is need complexity. So currently, HealthLeads treats all the patients who comes into their doors in a roughly same manner. But when we took a look at the information that we had, we found out that based upon what the patient told the HealthLeads worker in the beginning, in terms of what they needed, the patients would have a much different likelihood of disconnecting. So for example, the person at the top might come in and say, hey, I have these needs. I need better food, and my electricity has been shut off. And the person on the bottom might say, well, I need job training, and I need rental assistance. We know that looking at the data, the needs on the bottom are much harder to solve, no matter which hospital you're at, no matter what part of the country you are, than the needs on the top. But HealthLeads kind of treats these people in a similar manner. So what we built out is a form of a need complexity index, which tries to approximate how likely somebody is to disconnect, because we found out that the more complex your needs are, the more likely you are to disconnect. So with this information, when a patient comes in now, HealthLeads can say, well, we know this patient has these really complex needs, so why don't we assign to them the most experienced advocate, the most experienced social worker? Or why don't we refer them to a program that's better equipped to handle patients with these type of needs? The second thing we took a look at was how advocates interact with the patients. So right now, HealthLeads' model is, hey, we know that you have these different needs you told us about. We're going to call you once a week, give you some updates and information, and ask you if you've gotten those needs. Which makes a lot of sense, except when we took a look at the data, one thing we realized was that HealthLeads advocates could be calling much more frequently than they currently are. So both people, even though one of them has a much more complex needs, are being interacted with only once a week. So by day 30, each of them has only gotten 3 phone calls. But if you just take a look at the data, what it indicates is that one additional successful phone call, just having the person pick up one more time, significantly decreases the probability that they're going to disconnect from the program. And that makes sense. If you pick up the phone and you get a chance to build a relationship with the person who's trying to help you, you're more likely to stay engaged, you're more likely to stay positive and want to be a part of this program. But HealthLeads is worried that if they call too many times, then that's going to harm the relationship. What we found is that that's simply not true. So we suggested to HealthLeads that one thing they could do in the future is instead of calling once every 7 days, they could try calling once every 3 days, or just up the frequency of interaction. Because just one more successful phone call is going to really improve the odds that this person is going to make it through the HealthLeads program and get the resources that they need for a healthier life. Thank you.